Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. My name is Devin Gianetti, and I will be helping with today's briefing. Today, we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allen, Board of Health Director of Epidemiology Jana Rush, Board of Health Co-Director of Prevention and Wellness Ramona Brazil, and County Medical Examiner Dr. Tom Gilson. As usual, we will hear from our speakers and then have some time at the end for questions from the media. Just a reminder for media to stay muted until you ask a question at the end. We will now begin with County Executive Armond Budish. Thank you very much.
Thank you. Good afternoon, everybody. Let me start off by again offering my thanks for the great work of the staff of our County Board of Health. The pandemic continues to be a terrible scourge in our community, and our Board of Health is on the front lines. So I appreciate Commissioner Terry Allen, Dr. Heidi Gullett, Jana Rush, and Ramona Brazil. I know the work is hard and traumatic, and it's taking its toll. And for all of you watching, I want to thank you for your flexibility today. We moved this briefing to accommodate the governor's announcement of the arrival of the first doses of the COVID vaccine on December 15th. I know we're all anxiously awaiting the governor's plans, but in the meantime, we need to be patient. Getting the doses and then deploying them across the state, it's just going to be a major logistical exercise, and it's going to take a while. And unfortunately, right now, the numbers in our county continue to rise, and the hospitals continue to be strained. Our county is now on the watch list to go purple, which would be the highest level in our state coding system. And this morning, I spoke with Dr. Thomas Gilson, our medical examiner. He's informed me that he's preparing a request for refrigerated units to accommodate decedents, people who die. This has been a part of our pandemic plan since the beginning, that if we were to see a certain level of sustained deaths over the course of 3 days, that would trigger this response. Of course, none of us wanted to see this happen. It is terrible. Dr. Gilson is here today to answer any questions that you and the media may have at the end of this briefing. We're in a very dangerous time, and the experts you see here do not see our numbers improving if we don't begin to really change our behaviors. I know this is hard. We're in our holiday season. I hope that all of you had a very safe and healthy Thanksgiving. I know it was definitely not a normal holiday. We were asked to celebrate only with those in our own households in order to get COVID under control. Unfortunately, that hasn't happened. I know that some of you chose to share a holiday meal with parents, grandparents, and friends. Look, I understand. My wife, Amy, and I had planned dinner with our son, but we had to cancel due to the explosion of the virus. The numbers you will hear in a few moments do not reflect the Thanksgiving activities even. Let me repeat that. We're not yet experiencing the rise in illness and deaths that will be coming from gatherings over the holiday. Americans are individualists. We really don't like being told what to do. But to be blunt about it, doing what we want isn't necessarily doing what's right. We have to look beyond ourselves and remember, we're all neighbors. We are all members of one family, the human family. Please think about others. Follow the guidance of the experts like Director Allen and Dr. Gullett. They're only trying to save lives, including yours. These past few months have been exhausting for all of us. But for those of us who have lost loved ones, for those who have lost jobs and lost businesses, these months have been more than just exhausting. They've been devastating. We're doing everything we possibly can to support you, to help you, to get through this crisis. I wake up every day, thinking about all who are suffering and what can I and the county government do to help. Some days it's buying and distributing millions of items of PPE. Other days it's providing millions of dollars to hundreds of small businesses and arts and culture organizations. Recently, I woke up in terrible pain about the trouble our restaurants are going through right now. We've become a foodie county with great local restaurants. Our restaurants give our county character. Restaurants like Lola Bistro and Fire and other restaurants have given us a national reputation. But now, sadly, they're gone. And many more are on the verge of closing permanently. I read the impassioned pleas made by City Council President Kevin Kelly, Brandon Krastowski of Edwins, and Andy Udris of the Hofbrau House. Our restaurants need help. We in county government are trying. We're trying to help. A couple weeks ago, we announced that we were putting millions into round 3 of our Small Business Stabilization Fund, which includes support for restaurants. And I'm pleased to announce today that we've launched a restaurant stabilization fund of $1.2 million, offering grants of up to $10,000 each just for restaurants. You can go to cuyahogacounty.us/restaurant help and submit your application. The round closes next Friday, the 11th at 5 p.m. Grants will be administered by Destination Cleveland and distributed by Cleveland Neighborhood Progress. I'd like to thank both those organizations for their quick work on getting this fund ready. And I'd like to thank County Council for authorizing an emergency purchase from our CARES Act funds to get this money out quickly. We've got to save our restaurants. We just have to. Restaurants aren't our only food problem during this crisis. Way too many people are struggling to put food on their own tables. Come on, this is America. We shouldn't have our families, friends, and neighbors going hungry. The Greater Cleveland Food Bank reports that they're seeing more than 45,000 families, twice as many as last year. We had problems before the pandemic with nearly 200,000 people who were food insecure. Now our food insecurity rate has gone up by more than 30%. And it's even worse for our children. Child food insecurity, it's terrible. In Cuyahoga County, it's gone up more than 40%. So again, we're doing what we can to help. Earlier in the pandemic, we gave $200,000 to the food bank. This week, we released another $345,000 to the food bank. That translates to 426,000 meals, including more than 33,000 bags of food for the Backpack for Kids program. And today, I'm announcing that we're proposing to the County Board of Control giving an additional $500,000 to the Hunger Network. Thanks go to County Council for supporting these life-saving contributions, and they are truly life savings. And the local anonymous philanthropic family is providing $50,000 with the hopes of encouraging other generous individuals in our community who can afford to give to the food programs. Go to greaterclevelandfoodbank.org and click on the Give Help link, or you can donate to the Hunger Network by going to HungerNetwork/donate. Please do what you can to help. In America in 2020, people, children, should not go hungry. Finally, this pandemic has exposed serious racial and economic disparities that exist all across the county, all across the country. We're focused on improving equity in all sorts of ways. One role the county plays that you may not be aware of, we provide funds for road and bridge improvements. We work closely with our municipalities for design, construction, and resurfacing projects. Good roads and bridges enhance a community's livability. People want to live in places where the roads don't look like they've been bombed out. And good roads enhance access to local businesses. We're proposing to Council $17 million of road and bridge investments into 27 municipalities. We paid special attention to those municipalities which fall within the U.S. Census definition of poor economic health. This is a measure that looks at the portion of a community's households that are in poverty and the average annual household income of that community. So we're proposing projects in many underserved areas. In Bedford Heights, Broadview Heights, Cleveland, Cleveland Heights, East Cleveland, Euclid, Maple Heights, Mayfield Heights, Parma, South Euclid, and Warrensville Heights, among others. It's extremely important that whenever the county provides funding, that we look at communities that might require more investment in their infrastructure than others. We want everyone, no matter their zip code, to be able to live in a safe, healthy environment. Now, I said that was my last topic, but I hope you'll indulge me for one more moment. Our council president, Dan Brady, is retiring this month, and I just want to say how grateful I am for Dan's commitment and passion to the work that we do here at the county. He has been integral to virtually everything we do. Now, we didn't always agree. He's a vigorous advocate for his views and sometimes can be a pain in my side. But let me tell you, when you look up public servant in the dictionary, it should have his picture. Dan Brady has devoted his life to helping others. He's really one of the good ones, and I'll miss him. Now I'll turn it over to Terry.
Thank you, Armond. And as always, we appreciate your leadership. Your public health acumen grows each week, and your messages are strong and clear. And we appreciate the advocacy and the empathy for the pain that people are suffering, and it's been growing every day, as you know. And we're glad to be joined by Dr. Gilson. And I think the message you shared about his needs and preparation is should really, everyone should let that sink in for a little bit and understand what the implications are. And then certainly that's gives a sense of what our trajectory here is in the coming months. So as Executive Budish mentioned, we're now in the watch list for purple, for risk level 4. And all 88 counties are at high incidence, which is clear. But if you look among the counties that are purple, most of those are in Northeast Ohio. Lorain, Medina, Summit, Portage, Lake, Richland, and Stark counties. So we are clearly experiencing a particular surge here in Northeast Ohio. So it was no surprise that we went on the watch list. The writing has been on the wall for some time, which is why we joined Executive Budish and Mayor Jackson in sounding the alarm a couple weeks back to institute the stay-at-home advisory in order to try to help to limit movement, to ask people to limit movement in order to try to curtail the opportunity for people to be exposed. So last week you heard that our positivity rate for COVID testing among area hospitals, somewhere usually between 35 and 40,000 tests per week, was 21.4%. The states above 15 were at 21.4 last week. Alarmingly, the rate continues to rise, and Director Rush will share some very disturbing news on where our positivity rate is headed. So we hope people pay attention to what that means and let that sink in as well. We've averaged over 600 cases a day over the last week, and the City of Cleveland Department of Public Health has seen over 200 cases a day, additional 200 cases a day, meaning we're seeing over 800 cases countywide every day. And remember that for each case, there's 2 to 3 contacts for each one of those cases. So these are very big numbers. And we are now over 7 times the rate of high incidence as defined by CDC, 7 times. And we're now, unfortunately, among the 20 top counties in the state with the highest rates of COVID transmission. We're going in the wrong direction. COVID-related emergency department visits have also increased for the 6th week in a row. And our staff have been forced to triage cases and contacts to reach the highest risk individuals. And you'll hear more about that from Director Brazil in a moment. As I mentioned before, we joined Executive Budish and Mayor Jackson along with urban counties across Ohio in issuing a stay-at-home advisory and implored our residents to stay at home for the Thanksgiving holiday and celebrate with household members only. We've been watching the data and case investigation and contact tracing information as well to determine if we'll see, in the words of Dr. Fauci, a surge upon a surge after Thanksgiving. For those who decided to interact with folks outside of their immediate family over Thanksgiving, a COVID-19 infection acquired last weekend could take more than a week to be reported. Median time that people test positive is 5 days after exposure, but it could take up to 2 weeks. A person who gets infected late this week might not display symptoms for several days. Some may be asymptomatic. They have to schedule a test, wait to get their results back, which could take several more days. We'll begin to understand the full impact of any increases from Thanksgiving over this next week. But the hospitals are already preparing, as you've heard on some of the statewide briefings from the governor. We anticipate a 2 to 3 week lag for hospitalizations, and then another 2 to 3 weeks for mortality to unfortunately increase. Our staff are now, as I mentioned, triaging and trying to deal with the most at-risk folks in our community. We know hospitals are also very concerned about bed capacity and staff shortages due to illness, given this major surge. And inevitably, we've seen data lags at the state level and at every level, given the unprecedented nature and explosion of testing that's occurring across the state. To compensate, hospitals have had to delay other medical care to make room for COVID patients, adding to the domino effect from this pandemic. Please understand that we are nearing or reaching capacity everywhere at the state and local health departments, hospitals, urgent care centers, and testing sites. This is very serious business. The governor reported that in the previous 24 hours when he spoke yesterday. He reported the previous 24 hours, Ohio reported 8,921 new coronavirus cases, the fifth highest case count reported in one day since the start of the pandemic. Nearly 400 more hospitalizations were reported, and an additional 82 people died from COVID-19 in Ohio. You may remember back in March, former State Health Director Dr. Acton stated that Ohio might see 10,000 daily new cases. We are headed in that direction, and it is very concerning. This is by no means a local issue or even an isolated Ohio concern. In fact, CDC Director Dr. Robert Redfield gave a stark assessment on the next few months, stating that they may be the most difficult time in U.S. public health history. The United States on Wednesday recorded its single worst daily death toll since the pandemic began, and on a day when COVID-19 hospitalizations also hit an all-time high of 100,000. The deaths from COVID show no signs of slowing anytime soon. This message was aligned from Dr. Redfield with the White House Coronavirus Task Force, where Dr. Birx urged the following. It must be made clear that if you are over 65 or have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked due to the immediate risk to your health. You should have groceries and medications delivered. The task force also said that if you are under 40, you need to assume you became infected during the Thanksgiving period if you gathered beyond your immediate household. Most likely you may not have symptoms. However, you are dangerous to others and you must isolate away from anyone at increased risk for severe disease and get tested immediately. If you are over 65 or have significant medical conditions and you gathered outside of your immediate household, you are at a significant risk for serious COVID infection. If you develop any symptoms, you must be tested immediately, as the majority of therapeutics work best early in the infection. These are clear messages, and they certainly carry forward for the coming holidays. If you're going to be mixing with folks outside of your household, you may be putting yourself and others at risk, and you need to act accordingly and isolate and be tested. Celebrating in person with only your household member is the right choice, and it's the safe choice during the holidays. And you can save lives through your sacrifices this holiday season. Our personal choices on how we celebrate and interact in our communities have everything to do with what our death toll may be in the future here in Cuyahoga County. I'm pleading with everyone to follow the personal protective measures that we all know well. Wearing masks inside your household, particularly if you've got young folks, and I do, where they're moving in and out of the household. You should be wearing a mask if they're within 6 feet of you, as well as in public places like grocery stores and department stores, and certainly in workplaces. Regular cleaning of high-touch surfaces also is part of that tried and true prevention group of measures. If you're interacting with anyone very close, 6 feet, wear a mask. Wear a mask. The actions you take today can save lives tomorrow. And we know that there is light. There is light at the end of the tunnel. And we're going to be hearing about that from the governor in just a bit. We track weekly flu activity in the county as well. And cases have remained mercifully low in the community since the start of the flu season. We hope that continues. What we don't want is we don't want this double whammy of flu and COVID spreading in the community. 2 infections. Someone potentially acquiring 2 infections could be incredibly tragic, have incredibly tragic implications. So we'll continue to monitor our flu data weekly. We also know there's a very effective vaccine on the horizon. We'll be hearing about that, as I mentioned, very soon. In the meantime, we all have very important work to do in the next few months, very important work. At the end of this pandemic, we all need to ask ourselves an important question. What did we do to help? And I want to take a moment to thank someone who's helped out through this pandemic and with us for over 10 years at the County Health Department, our Chief Counsel, Administrative Counsel, Tom O'Donnell, who's retiring here in not too distant future. He's been with us for 10 years. He's a seasoned professional. And I want to thank Tom for all the work he's given and done for our department and his passion in protecting public health. And we wish Tom the best in his future endeavors. But we have to also, all of us, ask ourselves, what do we do to help? All of us can help by taking a pass on holiday gatherings with people outside our household and following the prevention guidelines. These sacrifices will help to tamp down this runaway COVID-19 train in our community and region. On the weekends, I call COVID cases to stay connected to the true impact of this pandemic on our community. Lately, I've been hearing more heart-wrenching stories about hospitalized family members and loved ones in the ICU battling COVID. I spoke with a gentleman this past weekend who lost his wife to COVID the day before Thanksgiving. Now, just days later in his grief, he was isolating at home, fighting COVID himself. And his family members were leaving food and medication outside his door. He was alone. I respectfully offered to call him back at another time, but he wanted to tell me his story, knowing he might be able to save the lives of others who may have been exposed. It was an incredibly selfless act. Seems to me that the least we can do, all of us can do, is to reduce hospitalizations, protect healthcare workers, and limit the pain and suffering of others who may lose a husband, a father, a grandmother, or a wife in the coming months, is to make some small sacrifices over the holidays. So please make the right choice. Please make the right choice. In the words of our board member and pulmonary specialist, Dr. Sherry Williams, let's not fumble the ball on the goal line. Now I'd like to hand it over to Director Jana Rush to discuss our data brief. Thank you.
Good afternoon. Thank you, Terry. So we're looking at the first section of our data brief that I'll go through. So our total number of cases that we've had reported to date are 28,540 cases. We've had over 1,000 cases reported each week for the past 5 weeks. Specifically, during November, we've averaged nearly 500 cases reported per day. This has been a sharp increase over the last several weeks. This past week, we've averaged approximately 600 cases per day. For comparison purposes, we averaged approximately 100 cases per day for the entire month of October. So we have more than fourfold increased the number of cases that we are receiving per day. We also had our highest number of cases reported in a single day in November as well. We reached over 1,100 cases reported in a single day. For hospitalizations, we currently have over 200 hospitalizations that have been reported to date. An additional 50 were reported over this past week. And hospitalizations have remained stable overall throughout the pandemic, but they have increased from what we saw from the previous week. For deaths, we have more than 700 deaths have occurred to date, and 32 new deaths were reported this week. The highest number of deaths that we've seen occur during the month of November is 7 deaths. One is too many, so this is very tragic. Our percentage of deaths have also remained stable over the past week among our total cases. Next section. For our case demographics, they've also remained stable over the past month, but patients reporting a pre-existing condition has decreased slightly from 34% to 29%. Additionally, African Americans are 3 times more likely to be hospitalized than whites. Next section. So as you can see, our epi curve is showing the distribution of our cases by the date of illness onset. And so as you can see, we are definitely in the peak of cases occurring throughout the CCBH jurisdiction. And so we had our previous peak back in July, but we've surpassed that by a very, very large amount currently as we head into the winter. Next section. And for our case distributions for geographically, so this has also remained stable over the past month. We haven't seen a significant shift in the frequency of cases reported by zip code. Next section. Next is our graph on our hospital utilization. So we have observed an 80% usage for our critical care adult beds. This is the highest adult ICU utilization that we've seen during the entire pandemic. So we're absolutely increasing in the number of hospitalizations that we are seeing throughout the county. Next section. Our testing rates are also increasing significantly. Currently, we're at nearly 25% testing positivity rate throughout our hospitals reporting. This is an all-time high that we've observed since the beginning of the pandemic. Furthermore, Ohio has been added in our jurisdiction. We've been added to the Ohio Department of Health's COVID-19 travel advisory map. So folks who are traveling to our county are asked to shelter in place or quarantine due to the high rate of transmission throughout the county for people coming into Ohio. The nursing home positivity rate is also increasing significantly. We went from 5.8% at the end of October to 14.2% at the end of November. So that is more than double than what we saw just from a month ago. So to wrap up in conclusion and put the data into perspective, so we continue to observe the largest surge of cases since the beginning of the pandemic and our response efforts. So transmission is occurring very rapidly throughout the county. We urge you to continue to do your part to limit the spread within our community, especially for members who are at the highest risk for severe outcomes. We know that hospitalizations and deaths lag in occurrence after cases have been identified, and we will be observing this very closely over the next several weeks. Thank you. I will now turn it over to our co-director, Ramona Brazil.
Good afternoon. First, before I start, I do want to say one more thing about a person who's retiring from our agency. That's one of our public health nurse supervisors, Sherry Verhotz. Sherry's worked here for many years. She was the supervisor of our breast and cervical cancer project program that's helped thousands of women in our region receive cancer screening and diagnostic treatment. And in the last few months, she's helped to coordinate the case investigation side of our COVID response. So wish her the best in the future. The last few weeks have been very difficult. The most difficult time since the pandemic began. Our staff have worked 6 to 7 days a week, the majority of the pandemic, to try and meet the increase in the case surges. We currently have approximately 70 to 80 case investigators working per day, and that includes 40 temporary staff that have been hired to assist with the surge. We also have approximately 30 contact tracers that work with us from the Ohio Department of Health. We are tired, but we continue to be committed to serving our community. And 2 weeks ago, when we first started to see cases around 400, 600, 700, and then finally more than 1,100 cases in a day, I cried. Because I realized what it would mean for our community. And despite everything we were doing, it wasn't going to be enough. We're trying to reach everyone we can. And I knew when I saw those cases that we would have to start the triage. And for me personally, as a nurse, it's horrifying. But it's been necessary in the current situation that we're in. Just in November alone, we have received more than 15,000 confirmed cases, which is approximately 55% of the cases we have received since the beginning of the pandemic. We have used the CDC and ODH guidance to help us prioritize cases. And we continue to prioritize our schools, working to contact students and staff who are in the school setting, as well as residents and staff at congregate settings, such as long-term care and group homes. In the general public, we are prioritizing cases, including those who have results within 6 days of their collection date, those who are at higher risk for severe complications, and those who may have a higher number of contacts. We've also dealt with challenges in backlog of test results. Some test results we've received are as old as 2 weeks old by the time we receive them. We've had some erratic reporting. So we've had some days where we've had 400 cases. We've had other days where there's 700 and then 1,100. They've been bouncing up and down. Because time is of the essence, all of the cases now receive a letter when we receive their test results with instructions about isolation. We want to contact everyone, but we really do need the community's help. So we're asking people who are diagnosed with COVID that they begin isolating immediately and that they inform their contacts. Their contacts should begin quarantining immediately. This week, with the extra hours that our staff have put in, we have been able to reach those with the most recent test dates in our priority groups, as well as contacting people outside of those groups. But we are asking for people's patience because we are doing the best we can to reach out. As been stated, we are going to have to see what's going to happen in the next week or so from Thanksgiving. And we need to hear from our healthcare providers. Thank you. I didn't mean to cry. We need to hear our healthcare providers and the staff who work in nursing homes and group homes. They are the people who we've relied on, we've depended on them to take care of the sickest of us for 9 months. And people are tired, and we've held them correctly as heroes. And we owe them by doing our part to reduce the spread in our community. So we're asking, and I know people are tired of hearing the message, but this is where we are right now, and we need to get out of it together as a community. So we're still asking, please wear your mask, keep physical distance from others, and please stay at home if you're sick. And with that, I'll turn it back over for questions.
Thank you very much, Ramona. Now we have some time for some questions from the media. As a reminder, please identify yourself and your organization when asking your question. And when not asking a question, please remember to keep yourself muted. And with that, we can go ahead and get a few questions.
Hi, this is Courtney with Cleveland.com and the Plain Dealer. I wanted to circle back to the comments about the refrigerated units and Dr. Gilson. I'm wondering, our Executive Budish had said that there was a certain threshold of deaths over a 3-day period that would be met to trigger the ordering of those refrigerated units. What is that death threshold, and how close are we? What have we seen with those death numbers over the past couple days?
Thank you for the question. This is a proactive measure. We monitor average number of individuals who pass away in Cuyahoga County on any given day, which would be about 40 people. Our threshold is set to kind of see when we have sustained elevations there. Not everybody who dies in Cuyahoga County will be reported to our office, but about 50% of those individuals will. So we set our threshold at 3 sustained days of 30 or more deaths. And we achieved that in the last week, which was part of our disaster planning in coordination with the Emergency Medical Authority and the county executive to foster us to go to a next level of preparedness, which would be now to request the refrigerated trucks. I should stress that in conversations with funeral homes, they are reporting that they're busy, but not overwhelmed. There is not a storage issue right now, and that the hospitals have also participated in that planning for storage. We just want to be ready because, as the executive and Director Allen said, we're not sure what the impact of the Thanksgiving holiday is going to be.
Thank you. When do you expect those units to get here, or when will you order them?
We're submitting our request to the state through our emergency medical agency, or emergency management agency, and I would hope they would be here sometime next week.
Thank you.
Any other questions? Okay, well, thank you very much for the question. That concludes today's briefing. Thank you very much for joining us today, and we hope you have a good day. Take care.